and welcome to today's episode of Health Mantra with Manipal Hospitals. I'm your host Heather, and today we're going to be addressing a concern that I'm sure every parent has dealt with at some point. I know I have. We're talking about cough and kids. Now, coughing, yes, it is one of the most common. However, it can also be severely stressful, both for the child and for the parents. I remember sleepless nights, endless worry, my husband holding the kid up all night because the minute you put them down, the incessant coughing would start up again. Now, do you wait out the cold? Do you perhaps prescribe a home remedy? Do you head straight to the doctor? When is it just a common cold, and when should you be maybe a tad bit worried? Now, yes, we all have a lot of questions when it comes to our kids, and we're going to be answering as many of them as we can today. Because in the studio, I have here with me Dr. Anshula Tayal Bansal, a dedicated pediatric chest specialist from Manipal Hospitals, Goa. Hello, Dr. Anshula, and thank you so much for joining us here today.
Thank you so much, Heather, and thank you, Prudent Media, for having me here today for this discussion.
Now, Dr. Anshula carries a prestigious DM in Pediatric Pulmonology and Intensive Care from All India Institute of Medical Sciences, Delhi, and her research endeavors and clinical expertise make her a trusted name in pediatric healthcare. Dr. Anshula is perhaps one of the only dedicated pediatric chest specialists in Goa. Dr. Anshula, let's start by asking a very simple question that all parents have. Now, coughing is such a common symptom, yes, but it has a variety of causes. Can you start by dealing with, what are the various causes that could cause a cough in a child?
Sure. So, the commonest cause of cough in children is usually a viral upper respiratory tract infection, which also has other associated symptoms like sore throat, runny nose, and sometimes fever. A child could also get bacterial infections of the throat, which is called pharyngitis, or infections of the tonsil, which is called tonsillitis. And the other less common causes include bacterial infection of the lungs, which is called pneumonia clinically, which is called pneumonia commonly. And it also has other associated symptoms like a high-grade fever, difficulty in breathing, or sometimes a dip in the oxygen levels. And then if the cough goes on for a certain amount of time, for a few weeks or months or even years, then we need to think of chronic causes of cough, which commonly include asthma and sometimes gastroesophageal reflux diseases. And then there are occasional causes of cough like foreign body aspiration, which is usually marked by a sudden choking episode, and then it can lead to a persistent cough for some time.
You talk about persistent cough. We also, allergies are another cause of persistent cough. Can you tell us something about what causes allergic-related reactions?
Right. So, when we talk of allergies, we most commonly talk of an allergic rhinitis, wherein you have a lot of sneezing, nose block, sometimes snoring in the night, and then you have asthma, which is also sometimes people refer to it as an allergic bronchitis, or it has different names. But basically, when you talk of a lower respiratory tract involvement with the allergies, it is typically asthma. So, when we talk of asthma, we usually describe the condition as a persistent or a chronic cough, meaning it goes on for weeks. So, the definition for chronic cough is a cough that goes on beyond a month. So, we call it a chronic cough, and it appears in episodes wherein the child may have cough for about 10 to 14 days. It may get better in between, the child may be totally well, and then again he may keep getting these symptoms again and again. And typically it is a dry cough, which is more seen in the night, sometimes in the early morning hours. And the child may often wake up from sleep because of the cough. There could be associated other symptoms like a wheezing sound, which is a kind of a whistling sound that the parents may be able to appreciate, or sometimes a physician diagnosis. And then other symptoms include breathlessness and sometimes chest tightness. And the symptoms of asthma are more when the child is running around, playing, exerting, or sometimes after laughing or crying.
So mainly cough at night. You're talking about after strenuous physical activity.
Right.
All of this is related to asthma.
It could be. So these are some of the pointers towards asthma. Yes.
Post-viral coughs also tend to linger, for longer than we would like. Is there anything that parents can do? Now, many parents resort to, say, over-the-counter medications for this. What do you think about that?
So that's a very relevant question, because since cough is so common, each parent has in some point in time has gone to the market and purchased some medications. Now there are a few things that we need to keep in mind. Like we discussed, cough is a symptom which can occur because of many conditions. Now there is no one size fits all treatment for all kinds of cough. So we need to see what is the underlying cause for cough, and then we need to treat it accordingly. The problem with over-the-counter medications is that one is, if you blindly self-prescribe a cough syrup for your child, it is most likely to be erroneous, because you're not sure of the underlying cause of the cough. And also, more importantly, these cough syrups have a lot of side effects. In fact, some of the cough syrups are not approved in children below 4 years of age, and that is the age group that commonly has a lot of cough with change of seasons and other things. So parents keep giving the cough syrups, some of which are not even approved in that age group, which can be harmful to the child. So it is important that if there is a cough that is bothering the child or has been going on for some time, it is important to visit your pediatrician and get a proper advice as to the cause of cough. When you speak of post-viral cough, so what happens is, after a viral upper respiratory tract infection, while the other symptoms may resolve, like your runny nose, sore throat and fever may resolve in a few days, typically 4-5 days, sometimes the cough lingers on, and it can take up to 2 to 3 weeks for the cough to resolve. That is why we call it chronic cough only when it persists beyond a month. So anything less than that, it could be a post-viral cough as well. So if the child has otherwise recovered, the appetite is good, child is playing well, and the cough is gradually going down day by day, you don't need to worry about the post-viral cough. It will just go away with time. So it is not necessary that we really treat it with medications. Sometimes age-old home remedies like warm saline gargles and honey ginger, these still hold good. They act as soothing agents, and because there is no specific cure for a viral infection. The viral infection will take its own course of 5 to 7 days, and the body will recover. Meanwhile, for symptomatic relief as a soothing agent, we can try these things like honey, ginger and all, so that the child feels better.
So basically this is just to give the child some relief.
Right.
So what you say is, do not resort to over-the-counter medications blindly. Now what happens if, say my child has a cough, I've brought her to you, you prescribe a certain cough syrup, for example. The next time the child has a cough again, can I not go and buy the same medication and give it to the child again?
Yeah, so that is a very common practice indeed, and it is probably more convenient and saves time. But the thing is, if you're very sure that the symptoms that have now started are exactly the same that happened last time, maybe it may be okay to try that cough syrup. Sometimes it is possible that the child may have a different kind of cough this time. So you may try the cough syrup that was prescribed the last time. If it doesn't work, or if the cough seems to be getting worse, or if there are associated symptoms like the child has a severe throat pain, or there's a very high grade fever, or there's any breathing difficulty, it is imperative that you visit your pediatrician rather than just following that previous prescription.
Because most cough syrups are broad spectrum.
Yeah.
So they should work.
Yeah, but having said that, if a cough syrup has 2 or 3 components, it also increases the chances of side effects, because each of the components is going to have its own side effect. So that is why. So all of the components are targeting a different mechanism of action, right? Some might. One of the component may be a mucolytic, one may be a decongestant, one may be an anti-allergic. So actually we need to see what kind of cough that is, so that we can rationally treat it with maybe just one or two compounds rather than using a cocktail of multiple ingredients. Yes.
Doctor, now we all know about the common cough, but are there any red flags, like is there anything that parents should be aware of, that you rush to your pediatrician immediately? Are there any red flags?
Yes, absolutely. So if the child is very lethargic, not able to eat or drink, he has a severe throat pain, the child is vomiting persistently or has a persistent high-grade fever, or if the child has any breathing difficulty, like there's a rapid breathing, there is if you can see some chest indrawing, the chest is going inside when the child is breathing, or the child appears very pale or blue, these are signs that you need to rush to the hospital for a medical advice.
Immediately,
yes.
You spoke about chronic conditions like asthma. Could you tell us what are the key indicators? How is it diagnosed?
Yeah. So, like I said, the typical symptoms of asthma include a chronic dry cough, which is going on for several months. The cough is typically worse in the night or in the early morning hours. It can also increase when the child is very active, the child has been running around, playing, so after exertion, the cough can worsen after laughing or crying. Also, it is usually associated with other symptoms like wheezing, breathlessness, breathing difficulty. An older child may be able to tell you that there is a chest tightness that the child is able to feel. And also, it is important that asthma has a genetic predisposition. So, if there is a family history of allergies, so parents, grandparents, or any of the first degree relatives, if any of them have a history of allergy in the form of an allergic rhinitis, dust allergy, eczema, allergic eyes, allergic conjunctivitis, any of these, then there are chances that the child may have allergies, and it could be asthma is one part of those allergies. So usually we are able to diagnose asthma based on the clinical symptoms. There are tests to confirm. We can do spirometry to confirm if the child has asthma or not. The diagnosis is usually made clinical based on a detailed history. If required, sometimes we can do, especially in an older child above 5 years of age, we can do the tests like spirometry to confirm it.
Would it go away on its own? Does asthma go away on its own?
So, typically it is said that there is no cure for asthma. Likewise, there is no cure for allergies, but it can be controlled with medications. So, when we talk of asthma treatment, the mainstay has to be steroids, which has to be inhaled steroids. So, asthma is basically an inflammation inside the lungs, in the airways, in the tubes which are where the air passes through. So, that swelling has to be reduced by means of giving inhaled steroids. And there are two modes of giving the inhaled steroids. We can give it either via a nebulizer or via inhalers. Now, both of these methods have their pros and cons. There's a very common perception among parents that inhalers can cause dependence or addiction.
That's addictive, yes.
So, this is a myth. Now, the medication that is used in a nebulizer or an inhaler is the same. If you see whatever medicine you have, so some parents are very comfortable nebulizing the child for months, but the moment we talk of inhalers, they feel that the child will get addictive. So the medication that is being given via a nebulizer or the inhaler is the same. It is just the mode of delivery or the device that is different. Inhaler is just a plastic container which delivers the same medication to the lungs that the nebulizer does. In fact, inhaler is more effective in treating asthma because the doses are delivered more efficiently into the lungs. It is more convenient to use, it is less time consuming, it is more cost effective, and also it can be used on the go.
Anywhere.
Yes. If you're traveling, if the child is in school, suppose he's playing in school, suddenly gets an attack, an inhaler can be used. You cannot use a nebulizer everywhere, so it doesn't give you that kind of a convenience. So definitely, between nebulizers and inhalers are the better method to give the treatment. For some children, as they grow older, they grow out of their asthma. It is called that the child has grown out of asthma. So it happens
without treatment or after treatment.
So typically, what happens is a child may be on treatment for a few years, especially when the child is younger. As he grows old, the frequency of flare-ups or the requirement of the medicine gradually goes down. We are able to taper the medications, and in some cases we are able to completely stop the medications as well as the child grows old. However, in some cases, as the child grows old, the severity or frequency of symptoms may go down, but the child may occasionally still need an inhaler. So that is the course that varies from person to person. So you cannot really predict if this child is going to have symptoms all lifelong or if this child is going to improve once the child grows older. But having said that, there is no cure for asthma. It can be controlled with medications.
Besides medications, are there any lifestyle changes that can help such respiratory conditions?
Yes, so thank you for asking that question, because there are a lot of lifestyle habits that actually trigger or increase the flare-ups of asthma. So it's very important to take care of those also along with the medications. So the most important thing is to control the triggers. One of the commonest triggers is the house dust mite. These are small microscopic organisms that thrive in our household environment. They are found in beddings, pillowcases, curtains, carpets, upholstered furnitures like sofa, cushions, all these. So in a child who is asthmatic, and if the child is allergic, so there are ways to find out if the child is allergic to a particular thing by means of tests like skin prick tests or other allergy tests. So if you find that the child is allergic to the house dust mite, it is imperative that you try to take these measures to get rid of the house dust mite from the home environment, because home is the place where the child is going to spend most of the time. So the bedding need to be washed very frequently in hot water, especially every 1 to 2 weeks. If possible, get rid of the carpets, get rid of soft toys. The curtains and sofas, these things have to be vacuum cleaned very frequently. Then other things in the home environment, sometimes some children may be allergic to pets. So there are ways, so if you are sure by means of an allergy test it has been diagnosed that the child is allergic to pet, one option is to find the pet a new home, but sometimes that is very difficult for the child and the parents. So then you can take measures like frequently cleaning or grooming the pet so that the dander is not shed too much, and not to allow the pet to come onto the bed or inside the room of the child. So try to maintain a distance. Then other things are that you can do is diet. That's very important because asthma is basically an inflammatory process that's going on in the body. So if the child takes a well balanced diet which is rich in fruits and vegetables that have antioxidants, it can help keep the inflammation at bay in the body. And also the child should avoid processed food, and especially foods that are rich in that are very high on sugar. So very high sugar content foods can also induce inflammation in the body. So that's another thing that needs to be taken care of. Sleep is a very important factor because stress is one of the major triggers or risk factors for asthma flare-ups. So sleep in general helps to restore the body and mind's balance, helps to keep the body and mind calm. So that also helps in asthma control. And deep breathing exercises like pranayam and om chanting, it has been shown in studies that if these are incorporated into the daily lives of children who have asthma, it leads to much better control of asthma. The flare-ups are much less. So even if a child has been put on medications or inhalers for asthma, these are the other things that need to go hand in hand, so that the requirement for medication may go down or at least not increase with time.
Doctor, I have another question for you. Now, I don't know if it's a misconception, whether we can call it a misconception. Now, we know that, little children with asthma, they've started school, and then of course they're coughing. Now, is that cough or that cold contagious to other children? Do you not send the child to school? How do you deal with something like it's an asthma related condition? Like we know that if you have a common cold, you have a viral cold, you don't send the child to school, right? Because then you would spread it. What happens in cases like this?
So asthma is not contagious. Okay. However, if the trigger has been a common cold at that point, that could be contagious. So what usually asthma attacks get triggered by viral infections, which is one of the commonest trigger. So if a child is in that phase where the child has got a new infection, runny nose, maybe a little bit of fever, sore throat, and a new onset cough, for a few days the child may be contagious till the time that viral infection is there. Usually in children with asthma, even after the viral infection goes off, the cough will persist. So at that time they are not contagious. So if a child has been well, gets a new infection, meaning gets a new runny nose, sore throat, that for a few days the child will be contagious like any child with a common cold. So it may be good to not let the child go to school during that time. Once that episode is over, or if it didn't start with a cold, if there was some other trigger, so there could be other triggers like exposure to smoke, dust, all these things. And if the child is just coughing without other symptoms, then the cough is not contagious, and it may be good to tell maybe the teacher at school that the child has asthma, so that the teacher is not worried that this child is going to spread the cough to other children. Yes.
Doctor, another question is, are there any situations or conditions where you seek out, say, a pediatric pulmonologist like you, instead of perhaps just go and visit a general pediatrician?
So if the cough has been going on for weeks or months, so typically chronic cough, it is good to pay a visit to a pediatric pulmonologist just to see if we are on the right track with treatment, because chronic cough can have a variety of causes which are different from the ones that we discussed for acute cough. So there could be multiple causes that could cause a chronic cough. Some of these cause a wet kind of cough, some of these cause a dry kind of cough, and then they may require some additional investigations. So if there is a chronic cough, then definitely the child should be shown to a pediatric pulmonologist. If there are any other pointers like the child is not thriving well, the child is not growing or losing weight, child is not eating well, or there are other symptoms involving any of the rest of the body along with the lungs. So for example, the child has persistent diarrhea or the child has persistent nasal symptoms, then it is good to visit a pediatric pulmonologist.
In your opinion, do you think early intervention makes a difference? Would it help in, say, chronic respiratory conditions?
Definitely. So chronic respiratory conditions will usually progress with time if not treated. So it is imperative to diagnose them correctly and start treatment, because the sooner you start, the more you are at a chance of protecting the lungs or preserving the lung function. If you leave the disease unattended, keeps on going on for some years, then the lungs would have already been to some extent damaged or destroyed by the time you actually seek professional help, and then it may be there may not be much left to do. So definitely earlier the intervention, the better it is.
Many parents also worry about a child's immunity. When you frequently get cold and cough, we know that once children start school, basically you catch a cold or a cough every single month. So is there anything that parents can do to help little children improve their immunity, help kids with their immunity?
So one of the important things is to teach your child basic hygiene, basic cough etiquettes. Although it may be difficult for very small children when they start school, but it's a good habit to incorporate frequent hand washing. If the child is coughing, better not to send the child to school. All these things, so that the child gets less exposed to viral infections that the other children may be having. Apart from that, like I said, a good balanced diet which is rich in fruits and vegetables is good enough to boost the overall immunity of the child. You don't need any separate supplements, health supplements or immunity supplements to boost the immunity. If the child is eating well, especially the fruits and vegetables that have all the multivitamins and the antioxidants, that is good enough to incorporate boost the child's immunity. You can also provide the child with vitamin C in some form. Although studies have shown equivocal results, but in my personal experience I have seen that vitamin C does help to improve the overall immunity. So if you can help, you can make the child drink either lemon water or amla in some form.
You're talking about natural forms of
vitamin
natural
C,
forms,
not supplements.
Not the supplement.
No, natural forms.
Doctor, another thing, coming back to, you said something about dust mites and dust in the air and all of that. Now we already know that secondhand smoking affects everyone around. But nowadays there's a lot of vaping that happens, and because there is no smell and there is no smoke, everybody thinks it's totally fine. Would vaping also make a difference to children with chronic conditions?
Yeah, so definitely when we talk of older children, vaping poses a significant issue when it comes to lung health. So it is incorrect to say that vaping has no adverse effects on the lungs. It does have adverse effects on the lungs and should be avoided as much as possible. Secondhand smoke, which is more common especially in the household environment, is one of the definite risk factors for asthma in children and flare-ups also. So if somebody is smoking inside the house, or if there is in general air pollution, that definitely makes the child more prone to get infections also, as well as it can make the child prone to develop asthma as well.
Dr. Anshula, one last question before we wrap up. As an expert in respiratory health, what's one takeaway that you want our listeners to take home from today's episode?
So my one takeaway message would be, in general, an overall well-balanced diet, good sleep and effective exercise should help in the overall general respiratory care of children who do not have any particular chronic problems. Even if the child has a chronic issue like an asthma, exercise and physical activity is one thing that need not be stopped. That is a trigger that we need to overcome with medications. So the children should be allowed to play, should be allowed to exercise and lead an active life, even though they have a condition like asthma.
Yes. Thank you so much, Dr. Anshula, for sharing your valuable insights with us today.
Thank you. Thank you for having me.
I'm sure you've not only helped me, but so many other parents like me out there deal with something as common as cough. To our listeners, remember that while most coughs are harmless, it's essential to stay vigilant. Consult a pediatrician when in doubt, and as Dr. Anshula has told us, always better to consult a specialist rather than rely on over-the-counter medications or self-prescriptions. If you have any concerns, do not hesitate to reach out. Dr. Anshula is of course available for consults Monday to Saturday at Manipal Hospitals in Donapaula, North Goa. For more expert advice and guidance, keep watching Health Mantra. Stay tuned to Prudent Media. Until the next time, this is Heather saying bye. Stay informed, stay healthy, and take care.